Okay, so today I'm going to be giving a subcutaneous injection. So the first thing you want to do is you want to check your doctor's orders to make sure that the medication that you are giving is ordered. And today I'm going to be giving 5,000 units of heparin, but all we have available is 10,000 units of heparin per milliliter. So I'm going to be giving 0.5 milliliters of heparin. So the next thing you want to do is you want to assess your patient's allergies. So if they have an allergy to heparin, you do not want to give them heparin. So you're going to gather your supplies, and you're going to wash your hands, and then you want to check your 6 rights. So right patient, right drug, right dose, right route, right time, and right documentation. So for a sub-Q injection, you can give, the right needle you can give is a 23 gauge, 25 gauge, or 26 gauge. I'm going to be giving it in a 1 milliliter syringe, and the needle length can be 3/8, 5/8, or 1/2 of an inch. So I'm going to be giving a 1 milliliter syringe, and the needle is a 25 gauge, and it is 5/8 of an inch long. So next thing you want to do is you want to check your MAR 3 times. One time when you're getting the medication out of storage or the Pyxis, another time when you're drawing it up, and then another time at the patient's bedside. You also want to make sure that it's not expired because you don't want to give an expired medicine. So when you're drawing it up, you want to take your vial and an alcohol pad, and you want to clean the top of the vial. And since we're giving 0.5 milliliters, that's what you want to draw up of air in the syringe. So that's 0.5 milliliters of air. To uncap your syringe or your needle, and push the air into the vial, and then you slowly want to draw up 0.5 milliliters so that you don't get any air bubbles. In case you do get any more air bubbles, you can just flick the syringe until they come up. Now, since this is heparin, you also want to check this order with another nurse. So I would verify this with another registered nurse. I would recap this needle, and then I would change out the needle so that I can give a fresh needle to the patient. So when I transport this medication, I want to label it. So this is heparin, 0.5 milliliters. When I get to the bedside, I want to wash my hands and put on my gloves, and I want to introduce myself to the patient, and then have them tell me their name and their date of birth or 2 other identifiers. And then I want to ask them if they have any allergies again, and then after I make sure they don't have any allergies, I'm going to do a focus assessment, which in this case is going to be making sure that their platelet count is not too low to give them heparin. So when choosing a sub-Q site, you can either choose the back of the arm, the abdomen, the flanks, the outer part of the upper thigh, or the upper part of the buttocks. So when you're getting ready to give your medication, you want to take an alcohol pad and clean the skin for at least 30 seconds. Make sure it's completely dry. And while I give this medication, I want to make sure that there's an antidote close by just in case the patient has a bad reaction to it. And in this case, the antidote is protamine sulfate. So once the skin is dry, I'm going to give the injection. So you pinch the skin so that you have all the subcutaneous tissue to inject, and then you can inject in a dark light motion in 45 to 90 degrees. So I'm going to inject the medication slowly, and then you take out the needle and you release the tissue. You do not want to massage the skin, and then after that you want to dispose of your needle in the sharps.